Hello everyone, welcome to our health series, where we break down complex medical topics into easy-to-understand information for you and your loved ones. Today we're diving into a common issue that affects millions of people worldwide, esophageal reflux, which you might know better as acid reflux, or heartburn. This condition is something most of us have experienced at least once, but few truly understand what's happening inside the body. That fiery, burning sensation in your chest after a meal is more than just a minor annoyance. It's actually your body sending you a warning sign that something isn't quite right with your digestive system. Esophageal reflux happens when the contents of your stomach, including powerful digestive acids, travel backward, up into your esophagus, the tube that connects your mouth to your stomach. This backward movement is not supposed to happen and can cause a lot of discomfort. Imagine your digestive tract as a one-way street designed for food to move smoothly downward. With reflux, however, the traffic suddenly reverses, sending stomach acid the wrong way and causing irritation. This backward flow of acid irritates the sensitive lining of your esophagus, leading to that familiar burning pain, and if it happens often, it can even cause long-term health problems like inflammation or scarring. Many people mistake heartburn for a heart problem because of the location of the pain, but rest assured, it's actually a digestive issue, not a cardiac one. It's important to know the difference between occasional reflux, which is common and usually harmless, and chronic conditions like GERD, gastroesophageal reflux disease, which require medical attention and ongoing management. Almost everyone experiences heartburn from time to time, especially after a big meal or spicy foods. But if you find yourself reaching for antacids frequently, or if symptoms disrupt your daily life, it may be a sign of something more serious like GERD. In this series, we'll explore the causes, symptoms, and effective steps you can take to manage reflux, so you can feel empowered and take control of your digestive health and overall well-being. Esophageal reflux, more commonly called gastroesophageal reflux, GERD or GER, occurs when stomach contents, acid, bile, or partially digested food flow back up into the esophagus. Common symptoms: heartburn, burning feeling behind the breastbone, sour or bitter taste in the mouth, regurgitation of food or liquid, chest discomfort, chronic cough or throat clearing, hoarseness or sensation of a lump in the throat. Why it happens? Reflux usually occurs when the lower esophageal sphincter, LES, a ring of muscle between the esophagus and stomach, does not close properly or relaxes too often. Factors that can contribute include large meals, lying down soon after eating, obesity, hiatal hernia, smoking certain foods, spicy, acidic, fried, chocolate, caffeine, alcohol. How does this backward flow happen? To understand acid reflux, it helps to know a bit about how your digestive system works. When you swallow food, it travels down your esophagus, a muscular tube connecting your mouth to your stomach. At the end of this tube is a special ring of muscle. Picture a muscle at the bottom of your esophagus, the lower esophageal sphincter, or LES for short. This muscle is like a valve, sitting right where the esophagus meets the stomach. The LES acts as a gatekeeper, opening to let food and liquid pass into your stomach, then closing tightly to keep stomach contents from coming back up. It's a simple but crucial job. Reflux occurs when the LES weakens or relaxes at the wrong time, allowing harsh stomach acid to flow backward into the esophagus. This backward movement is what causes the burning sensation known as heartburn. Your stomach is built to handle its own acid, but your esophagus isn't. When acid escapes, it irritates the lining of your esophagus, leading to pain and discomfort. Several factors can make the LES weaker or put extra pressure on it. Eating fatty or spicy foods, having large meals, or carrying extra weight around your abdomen can all contribute to this problem. A hiatal hernia, which happens when part of your stomach pushes up through the diaphragm muscle, can also make reflux more likely by disrupting the normal pressure that keeps the LES closed. Understanding these mechanics shows that reflux isn't just random, it's a physical problem with clear, identifiable causes. Knowing what's happening inside your body is the first step to finding relief. Certain foods and drinks, like chocolate, peppermint, and alcohol, can relax the LES even more, making it easier for acid to escape. Caffeine and carbonated beverages can also be culprits. Large meals or excess weight increase pressure inside your abdomen, which can force the LES open and push acid upward. Even tight clothing around your waist can have an effect. Pregnancy and hiatal hernias also raise the risk of reflux by changing the pressure dynamics in your abdomen. Hormonal changes during pregnancy can further relax the LES. By recognizing these triggers and understanding how reflux happens, you can take practical steps to manage symptoms and prevent future episodes, leading to a healthier, more comfortable life. The classic symptom of esophageal reflux is heartburn, a burning pain moving from your stomach to your chest. This sensation worsens after eating in the evening or when lying down. Reflux isn't just about heartburn. Regurgitation and difficulty swallowing are common signs. Chronic acid exposure can cause inflammation and narrowing of the esophagus. Beyond the chest, reflux can cause a chronic cough, hoarseness, or a sore throat. Acid fumes irritate airways, triggering a cough reflex. Some experience asthma-like symptoms as reflux material irritates the lungs. Dental erosion and bad breath can also indicate reflux. Recognizing these symptoms is crucial for proper diagnosis and treatment. Persistent cough or trouble swallowing might signal esophageal reflux, not just a cold. Understanding these symptoms helps in seeking appropriate care and relief. Why does reflux affect some more than others? Lifestyle habits and conditions play a role. Excess body weight increases abdominal pressure, forcing the LES open. Losing weight can significantly reduce this pressure and relieve symptoms. Diet is crucial. Spicy, fatty, and fried foods trigger symptoms. Beverages like coffee, tea, and alcohol can relax the LES or increase acid production. Smoking relaxes the LES and reduces saliva, a natural acid buffer. Eating large meals or eating close to bedtime increases reflux risk. Hiatal hernias and pregnancy also predispose individuals to reflux. Identifying personal triggers and making lifestyle changes can manage reflux effectively. Understanding these risk factors empowers you to take control of your health. Simple adjustments can provide significant relief and improve overall well-being. Persistent reflux symptoms warrant a doctor's visit for proper diagnosis and treatment. Diagnosis begins with discussing symptoms and medical history. For classic symptoms, this discussion often suffices for a GERD diagnosis. Severe symptoms or alarm signs may require further testing like an upper endoscopy. An endoscopy allows doctors to see esophageal damage directly. A pH probe test measures acid exposure over 24 hours, correlating with symptoms. Esophageal manometry tests muscle contractions and LES function. These tests help tailor treatment plans for effective symptom management. Esophageal reflux is manageable, and you can make a significant health difference. Listen to your body. Symptoms are signals for attention and care. Daily choices like smaller meals and avoiding triggers provide relief. Weight management, quitting smoking, and reducing alcohol intake improve overall health. Lifestyle changes are the foundation of successful reflux management. Partner with your healthcare provider for accurate diagnosis and effective treatment. Medications are part of a larger strategy, not a standalone cure. Protecting your esophagus is investing in your future health. Proactive steps prevent serious complications from untreated GERD. Understand reflux, take action, and pave the way for a healthier future.